Hi there, Dr. Seth Gerlach with Core Health, board-certified chiropractic internist and functional medicine practitioner. Today I'm talking about testing conventional medicine versus functional medicine. I get so many patients that come in and they say, Doc, I've been to my doctor, they ran all the tests and everything's perfect. I am healthy. And then we come and we run some of our tests and we find that's not the case. So again, conventional medicine the whole model was brought about very long time ago, decades and decades ago, when the biggest things that were hurting us or killing us were things like infectious diseases. Now we know chronic diseases are the number one thing in America that kills us. Actually, 7 out of people will die of a chronic disease, not things like infections or anything acutely like that. So with that in mind, these are just two separate models. I'm not saying we throw away conventional medicine, we still need it for acute care. Infectious diseases, car accidents, surgeries, they are amazing at that. Functional medicine it's a different form of healthcare it's focused around getting to the root cause of someone's chronic health disease, finding it, fixing that so we can get healthy and stay healthy long term, where we don't need medications to keep us going. So let's start with conventional medicine here. Like I said, conventional medicine is focused a little more on isolated parts of the body. So we're going to be looking at, let's say, my stomach hurts, we're just looking at the stomach. I've got a headache, we're just looking at the brain. Let's take a picture of the brain to see what's going on. I've got swelling in my feet, let's look at our feet. So this is functional medicine differs from that in we're looking at the whole entire body. Functional medicine realizes that the body is all interconnected. The head's connected to the brain, the toes connected to the gut and the joints and the hormones. The thyroid's connected to everything. So if someone comes in with a problem, we need to look at the entire body, because I always say this, everything can cause everything. It's important to look everywhere. Conventional medicine, again, these tests aren't bad. Colonoscopies, endoscopies, they're great at picking up big, bad, frank diseases, polyps, cancers, tumors, things like that. We're great at picking these things up in conventional medicine. Conventional medicine does a basic blood panel, just the bare minimum in order to see just a few of the body systems in the body. We'll get back to it later. And then also utilizing imaging, MRI, CT, ultrasounds. Again, not bad stuff. This is more acute care, finding big bad things like we said, cancers, tumors, blood disorders, things like that. Where functional medicine is focused more on, again, what's the health and the functionality of the different systems in the body. So the tests I have listed here are great at testing how these systems in the body are functioning. So we think the hormonal system, the gastrointestinal system, detoxification system, all these we need to look at and make sure they're functioning at 100% so you can be healthy. So functional medicine utilizes things like comprehensive blood panels. When people go to the doctor and they say, or if they have thyroid issues, they usually get one test ring, that's TSH. Where in reality, there can be 9 to 11 different tests to run to really evaluate the functionality of a thyroid. And other things in the comprehensive panel, looking at diseases before they become a problem. I've had many people come to me with high blood sugar, high hemoglobin A1C, and their doctors are waiting until they get prediabetes or diabetes in order to give them medication. Wouldn't it make more sense to find that early and make sure it doesn't happen in the first place so we're not reliant on medications for the rest of our lives? It's just simple stuff, I think anyway. So utilizing other tests, we can use saliva to see what the functionality of hormones in our body, urine to see hormones. We can also see metabolites in our body, breakdowns of different nutrients, gut bacteria. We can see how we're able to detoxify. A stool test can show a balance of good and bad bacteria in our gut. Do we have infections, hidden chronic infections in our gut that can stimulate our immune system? Things like parasites, H. pylori, pathogenic bad bacteria. Is our gut inflamed? Can we even digest the food that we're eating? And lastly, we talk about food sensitivities. The food you eat can either build you up or they can break you down. So have you ever noticed you've eaten a food and it doesn't really agree with you? So there are certain ways to able to detect to see which foods are actually creating inflammation in the body, which can lead to diseases down the road. All right, so I guess I hope you enjoyed this quick little analogy of conventional medicine versus functional medicine testing and the need for both of them. Hope you have a great day.